So a few years ago, statistics told us 1 in 10 young people had diagnosable mental health conditions. This is now 1 in 4, and that is just diagnosed. Despite growing need, mental health support continues to be lacking, and this is the same for young people in Greater Manchester. For this in minority groups, this adds another layer of difficulty, and accessing support becomes an even harder challenge. As Mayor, will you ensure that mental health services are properly funded and accessible for all? And how would you plan to do this?
I think, Madison, this is a really, really key point, and I hope in answering Lydia, I've really showed how much I support these moves and agree with you. I think it's appalling that mental health provision has been cut. I'm more distressed by the day when I speak to friends who are trying to access CAMS services, because there isn't anything alternative other than that very high level intervention, and they're being told it's going to take 6, 7, 8 months to get some support. And for a young person in crisis who needs support now, they might not have that time. They need something to happen, and they need it to happen much sooner. And I think that every time that any mental health services and provision has been shut down, that has massively disadvantaged young people. And I worry whether that's had much more of a significant impact than just mental health concerns, whether it actually has had some fatal impacts on our young people. And that's something that I can't tolerate or accept. So it ties back in with where I was answering Lydia before, is that we need to make sure that there is services and provision within schools and signposting to those provisions. And you're entirely right, it needs to be funded. And that's very, very important. And to me, that is much more important as a COVID recovery scheme than additional lessons, as I've mentioned. The other thing that is really important, and it touches on talking the answer I gave to Izzy with regards to danger in schools, and talking about how we empower teachers. I think we need to really empower teachers to spot signs of mental health and mental distress in young people. And that's particularly within secondary schools and further education colleges, where you're not in the same environment that you are at primary school. You don't come in at 9 o'clock and sit with one teacher who can see whether you're getting more and more sad as the week goes on and can ask you what's going on. You might only pop in and see one teacher sort of for an hour or two over the week. But they all need to be looking out for our young people in the same way that primary school teachers are much better able to. And the only way we can do that is to have a provision of education and empowerment. And that would be tapping into accessing things like the teachers' inset days, where they go and have training and they go and stay, you know, when schools are shut, they will all be getting together, and they will do statutory requirement training such as safeguarding and GDPR training and those sorts of things. But there's also quite a lot that can be guided and that can be directed. And I think those are the conversations I'd want to be having with head teachers and school leaders, to say staff need to be really trained in those inset days and updated regularly on recognising issues relating to mental health. Because I think when you've got schools working as part of that community, as I've mentioned previously, and you've then got support services in place to back that up, that have been funded and have been funded through local authorities and through what, you know, where I can add as mayor, I think you've then got a sort of a much bigger safety net and web around young people, where people are picking things up and able to offer support, able to signpost. So that would be the key thing. And I think getting into staff inset days is actually really, it's an easy thing, because schools already have to have budget to cover training on those sorts of issues. It exists. It's very small after COVID and the extra cost, but it still is there as designated budget to school that we can access and ask, please do this. This is so very, very needed. So that would be the sort of immediate.
Okay, so as you're aware, Greater Manchester has 6.3 billion, I think it is now actually, 6.3 billion pounds of health and social care money that it has guidance and it has influence over as mayor, as combined authority. you're sitting down with all of the trusts and all of the commissioning groups and all of the GP groups across Greater Manchester and actually saying to them, we all know, we're all healthcare professionals, and I can actually say that because I am. We all know that prevention is better than cure. So in me, you've got an advocate for that. So let's do that. I'm not, it may take a while to get it organized and get it sorted out. But over the 4 years or 3 years in the next term, it's something that could be achieved. And lobbying central government for more money and directed money. So if we're saying 6.3 billion covers all healthcare and social care, actually we want an extra 50 million to cover this expanded service in mental health care. Can the Department of Health please top up our regional budget with that to allow us to do that? And lobbying specifically for those things. But it will be clinician led, and it will be led by people, facts, and actually knowing how services work and how they can work better. And know, the Mandarins in Whitehall and the Combined Authority, they're not doctors and nurses, they're not healthcare managers, they don't understand. So you need to actually empower our healthcare system in Greater Manchester to say, this is how we do it, and this is how much it's going to cost. But yes, I'm completely on board with you. And yeah, with a lot of things you'll find in healthcare, and you're pushing at a very open door with me, because I know the disparities in healthcare across Greater Manchester.
One of the first things I did as mayor back in the summer of 2017 was sign off a plan to increase by, I think it was around £60 million at the time, the budget for children, child and adolescent mental health. So that paid for the Mentally Healthy Schools project I was just talking about a moment ago. So there is a commitment there to increase the budget. What I also agreed was that we would publish waiting times for children's mental health services. So believe it or not, nationally they weren't published. And the reason why that's important is because people notice things that are published, because when you can see it, you notice the problem. So if the data is not published, then it just remains hidden, and it is hidden. And that's why children's mental health support has just been often treated as a low priority, because people couldn't really see the problem. But we became the first to do it, and now others have started to follow suit. And I think it's when you then identify the issue that you can then start to get more support into it. But as I said, I think we've got to take it to the whole next level. We've got to change the way we deliver services. We've got to make them more instantly accessible to young people. We shouldn't always be having to refer people for support. It should be people can self-refer and access support immediately. We need to do all of that, as well as improve the statutory children's mental health support services. So, you're absolutely right. It's a critical issue. It's been nowhere near good enough. We've taken some steps in the right direction, but it's got to be a big focus for us going forward.